If somebody's considering a career in nursing, I definitely go for it because there's so many opportunities that people don't even think of. I mean, they can be a bedside nurse, they can do more in billing. There's just a huge variety to whatever fits their lifestyle and what they're special at.
I didn't really know when I got into nursing what I wanted to do. I used nursing school kind of as an opportunity to see the different areas. When I originally started at Parkview, I started as a patient care technician, and the PCT role was so helpful. It's teaching you the basics of patient care. So my last semester of nursing school, I did 90 clinical hours with a nurse here in STICU, and immediately, it was probably 3 or 4 hours in, we got our first patient. It was a trauma patient. Again, this is them at their worst moment. I pretty much knew at that moment that, okay, this is where I need to be. So I, talked to the manager, applied for a position, and actually was offered a position prior to graduation. I was a bedside nurse for about 2 years in STICU, and then a rapid response position became available on our rapid response team. I applied for the rapid response position, and I ended up getting it. I was a rapid response nurse for about 2 years, and then just this last year, I was offered a nurse leader position here in STICU.
I started as a PCT in Family Birthing Center in PRMC, and after graduation, I started here as a nurse in ICU Randalia. When I first got the call from the Human Resource Department that I got the job in Randalia ICU, I was so happy and I felt like I finally made it.
It means something to people to be able to say they work at Parkview. I believe that our nurses are proud to be Parkview nurses because they recognize that what that means is that our patients get excellent care. And for them, that's why they came to work. That's why they just chose nursing. That's what keeps them coming back every day, is their ability to provide that excellent care. And that's really what we're about. It's the patient, it's our community, it's that focus.
I started in nursing and actually started out with the healthcare field as home health aide when I was a senior in high school, and I switched schools so I could take the EMT class, which then led me on my EMS journey of becoming a paramedic, and then I decided I wanted to become a nurse. So I used the tuition assistance from Parkview and got my nursing degree and started working in the part-time here up in the emergency room at Parkview Whitley. I continued on because I really enjoyed it, enjoyed the knowledge and the different patient base. So I got my BSN, became the house supervisor here. I'm currently the ED clinical supervisor in the ER and halfway through my master's program now. Parkview has done a lot of things to help progress my career. With the tuition assistance for getting into nursing school and then continuing that on to my bachelor's and the master's program, along with the scholarships that they have available, that has helped tremendously. I've had to pay anything out of pocket at all with that, so that's been great. They also are great in helping the people that want to advance in different leadership and helping them get into classes and making them strive to be the best people that they can be.
Parkview offers a lot of opportunities to grow better and farther. I'm getting ready to get the certification for holistic nursing, and I'm thinking about taking the CCRN end of this year. So these are really, really great opportunities that come, and it gives us the better opportunity to step up.
Parkview has blown me away in the advancement that I've been allowed to have. I never in a million years would have thought that in 5 years of nursing that I would move from patient care tech all the way to nurse leader in this unit. We're taking care of some of the sickest patients in the entire health system on this unit right here. How did that happen in 5 years? Parkview nurtured me through it all and has coached me and always been like, yeah, you can do it, you'll never be alone. We'll be able to help you.
I love being a Parkview nurse because of the environment, but it's more than that. It's the work friends that I have that become my work family. I've worked other places part-time and it's never been quite the same environment as it's been here.
It is what it's about here at Parkview, to be part of that Parkview family, to be extremely proud of that. And even though we have 11,000 coworkers now, we still feel like a family.
I think with Parkview, they have a great culture, and so it's like we want to give that excellent care every patient every day, and it's from day one when we hire them. That's how we train them, and that's how we treat each other and treat our patients, is we want to give the best care possible.